STEM City USA Healthy Doses series is your passport to a balanced lifestyle. Hosted by Dr. Tiffany Anderson and presented in the Boston Scientific Auditorium. And now, Dr. Tiffany Anderson.
Good morning, everybody, and welcome to another episode of Healthy Doses. My name is Rayondon Kennedy, and I will be your moderator today, just as I always tell them every week. You guys may remember that last week we mentioned that Dr. Anderson is actually going to be out today, but that is great because we have a wonderful guest host for us today, and we're going to be discussing heart health. And so, without further ado, I want to introduce to you Dr. Athol Morgan.
Hi, Ray. How are you doing?
Hi, I'm doing well, Dr. Morgan. Great to have you with us today.
Good to be here.
So, yes, sir. And so, Dr. Athol, Healthy Doses is a show that we put together to really give our audience here at STEM City USA the tools and resources they need to be the best version of themselves. And, typically we're talking about mental health topics, but you also need to work on your physical health, which is why I'm excited to have you here to really talk about good physical heart health, which is very important. But before we dive into today's topic, Dr. Morgan, I wanted to ask you to kind of introduce yourself to the audience and really kind of talk about your background and what it is that you do on a day-to-day.
So I am a cardiologist here in West Baltimore. I work for LifeBridge Health. In particular, I'm the director of cardiology at Grace Medical Center, formerly known as Bon Secours. I've been in Baltimore for 40 years. Came here initially to go to school. I spent 11 years training at Johns Hopkins, learning my craft, and then I was in Columbia for a couple of years, and then finally worked my way back to West Baltimore, and I have enjoyed my time here working as a cardiologist.
Yes, sir. So you say over 40 years, and so I think it's safe to say you know what you're talking about.
I've been at it for a little while, yes.
Yes, sir. Yes, sir. Well, it's great to have you. I know we have a great conversation planned. I want to run and do a quick break. But before we do that, I do want to just remind our audience that we love to hear from you. We love to participate. If you have any questions for Dr. Morgan or anything that we're talking about today, I want to make sure that you use the QR code that you see in the top right corner. And for those of you who don't know, if you're not watching on your cell phone, what you can do is just take your camera, open it up, scan it, and they'll take you to a page where you can ask a question anonymously, or you can give us your name. And so we love to hear from you, participate. And if you're on your cell phone, just look inside the comment section right now. I just posted a link where you can click that link and you can go to the same page. And so we love to hear from you. And we're going to jump into this conversation on heart health. And when we come back from this quick message. Welcome back to Healthy Doses, brought to you by STEM City USA and brought to you also by Boston Scientific. Today, we're going to be talking with Dr. Morgan about hypertension and heart health. I know, we've been dealing with COVID over the past couple years, and that has generated a very high death toll. But that really has heart has really taken out a lot more people as far as death numbers. And so I really think it's important that we talk about it and how we can prevent and actually what it is. And so, Dr. Morgan, when we're talking about hypertension, can we define exactly what that is for everybody?
Sure. Hypertension means that the blood pressure, the pressure inside the blood system is actually higher than it should be. And above a certain level, it starts to create problems for the body, the system. In particular, if the blood pressure is too high over a prolonged period of time, it can lead to strokes, it can lead to heart attacks, it can lead to heart failure, and cause significant amount of heart disease. It's probably the biggest preventable cause out here, other than cigarette smoking, of heart disease. And so we'd like to understand when we have high blood pressure as a problem. Fortunately, Ray, we now all have the ability to go get our blood pressure checked. You can have it checked at your doctors, your pharmacies, and I encourage a lot of people to actually, you can go to any pharmacy or store, Walmart, Amazon, and buy your own blood pressure monitor and measure it. And we define the blood pressure being high. As you know, there are two numbers. The top number, as my patients like to say, the top number are what we call the systolic blood pressure, and the bottom number are what we call the diastolic blood pressure. And the definition is a pressure higher than 140 on the top number or 90 on the bottom number. But of course, it's a scale, and the higher it is, the worse it gets, and the lower it is to a certain point, the better it gets. But that's where the cutoff, where we define the blood pressure as beginning to get to be too high.
So you talked about tracking it. Is that something that you think people should do regularly, not just, if you think, or not just if you're overweight or if you've been told? Is that something that everybody should be doing?
Everybody should check their blood pressure, especially if they have been diagnosed with hypertension. I was in a barbershop conversation once, Ray, and the gentleman I was talking to was surprised that I was suggesting that he should check his own blood pressure. And I asked him, I said, well, how often, sir, do you check your tire pressure? And he said, well, once a month. And I said, well, and you think the tire is more important than your heart? And we had a good laugh over it. So yeah, I think people should check their blood pressure regularly, especially if they've been diagnosed with hypertension. Yeah,
I have this Apple Watch that kind of tracks your blood pressure. Would you recommend those type of devices? We have a lot of wearable devices and things that are really kind of checking in with our biometrics. Are there any things that you might recommend, or should we just go and get kind of like the cuff, the digital cuffs, that they sell at maybe Walgreens or CVS? Any devices that you might recommend to kind of track that daily?
I think the cuff, as you call it, the regular blood pressure monitor that you can get at Walgreens or Walmart or online at Amazon. I don't mean to, plug any particular store or product.
Yeah.
It's fine. But I'm excited about this wearable thing, Ray, because we're starting to see now where people who are wearing a watch like the one you suggest are coming in because the watch alarmed and told them that their blood pressure was too high, or their heart rate was too high, or they have some kind of an abnormal rhythm that they were otherwise unaware of. Apple, I think, is at the head of the class where this is concerned right now. But I think time is gonna get us more sophisticated devices and other ones where people are going to be able to monitor their blood pressure, their blood sugar, and other things by wearable devices. It's a very exciting technology that I think is coming our way.
Yes, sir. And I can imagine that just like any other disease, the earlier you know that there's trouble, the earlier you can detect, the easier it is to kind of treat and kind of get on top of that. Would that be a fair statement?
Oh, yes, because the effects of high blood pressure occur over time.
Hmm.
Your blood pressure is high right now. That's not an immediate threat so much as if it stays high over the next year, 5, 10, 20 years, because that's what builds up the effect on the heart or on the brain over time. So the earlier you can get at it and the earlier that you start doing something about it, the more likely it is that you'll be able to avoid some catastrophe from having high blood pressure.
Yes, sir. And I'm glad you said that because, like you said, it takes time. Like you just don't wake up and be like, oh, I got high blood pressure. Like there's obviously a pattern of different things that led from point A to point B. And so my next question is, how or what are some of like the major causes, right? How do we get, to the point of hypertension or high blood pressure? What are some of the things that gets us there?
Well, first thing I would say is that some of us are at risk from the start, right? There are certain populations genetically that are at risk to have high blood pressure from the beginning. In particular, we know that, for example, in the African American population here in the United States, they're at higher risk to have high blood pressure. And if both your parents had high blood pressure, you're at risk, and so you need to pay more attention to your blood pressure over time, just because you already have that genetic risk. Additionally, there are going to be factors from outside, what we call the environmental factors that weigh in on it. And, it's my opinion that the biggest one affecting us out here now is actually sodium or salt intake in the diet. That, in the average American diet, we're taking in 2 to 3 times as much salt as we should. And we know that if we could eliminate that, much of the blood pressure problems would go away, and large numbers of complications, the strokes and the heart attacks that come from that would also go away. If we got back, Ray, this has been calculated, if we got back to optimal amount of sodium intake in this country, you're not going to believe this, but we could eliminate 40 or 50,000 strokes a year, 40 or 50,000 heart attacks a year, 40 or 50,000 deaths a year, just by getting our sodium intake or salt intake back to where it should be.
That's a lot. That is a big number. And it seems
Big
like
number.
it's such a simple fix to kind of just cut back on the salt and kind of get back in a healthy range. Um, Quick question that just came to me. When we talk about like salt and intake, or I guess hypertension in general, is there a difference between the number of cases that we have here in the U.S. versus anywhere else in the world, or is it pretty much standard across the board?
Well, it depends, I think, on we can match the prevalence, the risk of hypertension in populations around the world directly to the salt intake. And if we go back further, so the more, as we say, developed or advanced the populations are, it tends to have more salt in their diet. So if we got back to some remote populations in, for example, South America or Africa, where people are still not eating the kinds of processed foods that we have presented to us here in the United States, there's a lot less high blood pressure than we see. Approximately a third of Americans, adults in America, have high blood pressure. And one of the risk factors that you can't avoid is age. As you get older, that number goes up. So by the time you get to what we call Medicare age, 65, the vast majority of people have hypertension. But there are societies in this world where it really doesn't exist, where their diets are still what some people would refer to as primitive or rural or basic. And and they don't have the salt intake we have. They taking us a half or a third of what we're taking in, and they don't have high blood pressure per se.
While we're talking about different demographics, I want to know if there's any particular, just talking about the U.S., I guess, for this next question, are there any particular racial demographics or cultural demographics that might be more affected by this than others? I know in my family alone, we have a lot of family members who are either struggling with hypertension or struggled with hypertension. Unfortunately, maybe they passed away from those things. But is there a particular demographic that might be affected maybe disproportionately than others?
Yeah, it's said, it's known that in African Americans in particular, this is a problem. There are some of the smaller groups, but I think if you're talking to individuals or people, Ray, what you just said is what's important. If you have it like that in your family, then you're at risk, and then you need to be paying attention because it is a genetic thing. And there are also social groups of people who have less resources in terms of economics. They live in places where the diet is poorer because of the foods that are available to them where they live. There are those kinds of social enclaves all around the United States where they're going to be at higher risk for hypertension.
And so is there help, like, for those populations that may not have all the resources? Let's talk about what are some of the things we can do to kind of reduce it? And in those demographics where it may not be as easily accessible, what can they do to try to, get the numbers down or prevent it altogether?
Well, I think you're on point here that what we need to do is be educated, right? So if you're at risk or you're in that kind of a situation, what are the things you can do? We talked about adjusting your diet to take in less salt than you're doing. It's also directly connected, high blood pressure, to being overweight. And so weight loss is another big factor. Physical exercise. We seem to be doing less and less physical work as over time. The recent pandemic, there are people working at desks. We're just not getting out there. People are not as active as they used to be. And, increasing your physical activity is another thing that can help with blood pressure. And then finally, if you have high blood pressure, your physician may ultimately, and this happens a lot, prescribe medications to lower the blood pressure, because what we do know is that however we get the blood pressure to come back down, we end up reducing the risk of going on to have a stroke or heart failure or one of these other complications over time. So that's, we always want to try to make changes in our lifestyle before we get to medications, but whatever can be done to get the blood pressure down, that's what's going to reduce that risk.
Yeah, and that's got to be the priority. So, Dr. Morgan, so we talked about hypertension, we talked to define it, we talked about good practice. One of the things that I like to do on Healthy Doses is really talk about when is it time to seek help, right? And so we don't want to wait until we have a heart attack or a stroke or any of these major events that are pretty catastrophic. When is it time to really be like, oh, this number is high? You talked about checking it every day. When should we really start to kind of seek help and really come in to see someone like you?
Well, as you said, if you get a signal that your blood pressure is high, if you're at a screening or something and you get your blood pressure checked, it's high. If you check it yourself and it's high, then you should seek help. If you have one of those watches and it alarms and tells you your blood pressure is high, you should seek help. Most people who have high blood pressure now actually are aware of it. So I think the important thing for us is to keep reminding people, keep educating people, encouraging people to know that managing the blood pressure really is worthwhile in terms of reducing risk. So for people who already have high blood pressure, I encourage them to keep track of it themselves. A lot of times You go to the doctor, they prescribe a medication. People don't always take it the way they should, but if they were actually measuring the blood pressure themselves, then they would know when it's high and that they should take it. Poor compliance with the treatment as prescribed is often another problem that we have with people who have high blood pressure.
Dr. Morgan, I'm going to take a quick break, but when we come back, I have a special host who's going to come and talk to you. You talked about, being educated, and I really think that our next guest is really going to kind of talk about that, because she's doing some great work. She's 16 years old, and she's doing a lot of work to educate young people early on about good heart practices and good healthy habits. And so when we come back, Miss Savannah Carmel is going to join us for the conversation.
That's exciting.
Yes, sir.
We know how to treat the colds and the coughs. We know how to treat the bumps and the bruises, the cuts and fractures. But how do we treat, I can't afford a day off work to see a doctor? How do we treat, I've never had a doctor who speaks my language? How do we treat, I don't know how to connect with some of my patients? How do we treat, you're not listening? We can't treat what we cannot see. So we have to look closer and see what we're missing. People, patients, misdiagnosed, misunderstood, overlooked. These are the people left out of a system charged with helping them. And it's up to us to find them in our communities, in our relationships, in our data. We're meeting them where they are, discovering who they are. We're taking an honest look to understand their healthcare needs and delivering effective ways to reach them. We don't have all the answers, but together we can find the way to address the gaps in our healthcare system, to provide something better, to find more chances to save more lives. It won't be easy, but we can help make it right, because no one should be missed.
What's up, everyone, and welcome back to Healthy Doses, brought to you streaming live from the metaverse of StemCityUSA.com and brought to you by our wonderful partners at Boston Scientific. We've been talking about hypertension. We've been talking about heart health this morning with Dr. Athol Morgan, and we're about to invite our guest moderator up. But before we do that, I just want to let you know and remind you that if you have any questions for us throughout the rest of the show, feel free to open your camera and scan the QR code at the top, or check the comment section, because I will be dropping another link there. And so if you have any questions, click the link, scan the code, and really chat with us. If you're in the STEM City auditorium right now, you can use the chat button that's off to the left. We'd love to hear from you. We'd love to ask some questions for Dr. Morgan. And so before we left for the break, I mentioned that we have a young person, Miss Savannah Carmel, who is the CEO of Happy Heart. And she's been doing a lot of wonderful work. And so, Savannah, we're happy to have you here today. How are you today?
Thank you so much. It's so great to be on. It's so great to be on Healthy Doses with Dr. Morgan and with Mr. Kennedy, and I'm so glad to be on.
Hey, Savannah.
Hi.
And so, but say I'm really going to bow out, because Savannah is going to she's going to have my job one day. But I do want to introduce, she's been doing amazing things. She's wrote a book. She just had an article published on her. Really Google her name and look that up. But she's doing some amazing things. And so, Savannah, I know you had some questions and wanted to have a conversation with Dr. Morgan. And so I'm going to give you the floor. Take it away, superstar.
Sounds good. Anyways, as I mentioned, it's so good to be on. It's such an honor to be on Healthy Doses and to meet you, Dr. Morgan. I'm so inspired by all you do, as I also seek to become a cardiologist when I grow up. So seeing the work that you do in the Baltimore community, it is so amazing. So I had a couple questions for you, and also just wanted to talk about further about the work that you do. So I know that you mentioned a lot about prevention, and that's also one thing I focus on as well for my organization. Happy Heart is very focused on preventative measures, especially with diseases, with heart-related diseases. It's so much better to prevent it rather than cure it. So I wanted to talk to you more about prevention and why it's so important to prevent heart disease rather than waiting later on in life until that person gets heart disease and then they have to cure it if they make it out alive.
Yeah, and to take what you just said, we don't always have any cure. And so, if you wait until, for example, you have a stroke, then you've had a stroke, and there's a certain amount of disability that comes with that, limitations on your lifestyle, suffering, that can be avoided by prevention. So I think you're right on in saying that prevention is much superior to treatment, especially if we don't have good treatment. And as you point out, some people may not survive an event like a heart attack or a stroke, yet it could have been prevented if the blood pressure was attended to, or any of the other factors that that affect disease. We have the same situation, for example, when we talk about stopping smoking. I've sometimes have these discussions with patients, and I say, look, if you wait until the doctor says, look, I think you have lung cancer, then you have lung cancer, right? And it's not going to be, you can't undo that. And so you really do have to start years ahead with preventive measures. I view this economically sort of the same way as saving for retirement, right? You can't wait until you're 60 and then say, I better start doing something about my retirement. That's not going to happen. So you have to start way back thinking about what it is I'm supposed to be doing for my health and paying attention to it when you're your age, really, to make sure that you avoid some of these complications that can come up later. So yes, prevention is far superior to cure, and it's also a lot less expensive.
Thank you so much for that insight, Dr. Morgan. And I also really appreciated how you tied it back to me and to youth in general. When thinking about prevention, there's no such age as where, oh, if you're too young to start thinking about your heart, you're too young to start putting these health measures in place. I definitely believe that the younger the person is, and the more we start educating people and youth about their hearts so that they can start taking initiative, the more it's going to pay off in the long run. Like how you mentioned earlier. It's like saving up for retirement. You don't start when you're 50, you don't start when you're 60, and you're reaching retirement. You start early on in life. The earlier, the better. And I also wanted to touch more about prevention measures because I would doing through the work that I do with Happy Heart, we take a very preventative standpoint where we go in the communities and we specifically target youth and their families to teach them about the heart because number one, I believe that youth have the power to create changes not just within their own lives, but within their communities around them. So that's why I believe in empowering youth. But also, once you start empowering youth and they start creating these healthy habits, that will then translate to the next generation. We talked earlier about how these heart diseases, cancer, these strokes, it is past, sometimes it is genetics. Genetics has a lot to do with these diseases. It plays a big role. And I believe that it can also be the same with preventative measures as well. If we take preventative measures within our family, we start at this generation, and this one generation is like, let's put in preventative measures. Let's start practicing healthy habits that will then translate to the next generation and generations to continue. So I really appreciated that insight. I also wanted to touch base on what prevention is and how people can start preventing in their everyday lives. Within Happy Heart, when we do prevention and when we teach communities, I believe there's two sides to this coin. First, there's the education standpoint where we actually educate people about their heart, what it does, all these different things, all these what the diseases do and why it's important. And then number two, the most important part that a lot of programs don't really put in place is actually giving the communities the resources so that they continue to live these healthy lives. So can you please touch base on why it's so important to not only educate, to be educated, but also to have the resources and the tools to have a healthy lifestyle?
Yeah, I think you're right. And you said something that I want to latch on to, which is this business of habits, right? We want to create healthy habits and we want to discourage unhealthy habits. And we can each do that with some discipline in ourselves, but we can also reach out to other people. In particular, we create a lot of unhealthy habits in our children, if as parents, right? If we bring our children up eating sodas and McDonald's and these other things, then we're creating unhealthy habits and missing an opportunity to create healthy habits. As policymakers, when we build a community, have we created spaces for physical exercise, right? Have we built enough parks? Have we built enough basketball courts? Have we put up leagues? And for recreational purposes, we're all big on competitive sports. But what about the recreational sports? Do we have walkable neighborhoods? Have we created, paths and structures for people to get out there and do physical activity? All of that is an important part of building a healthy community. In addition to educating individuals to do what they can and should be doing for themselves, as you say, from a policy standpoint, the society, the government, the community should be creating the spaces and the resources for people to get the amount of exercise that they need.
Thank you so much for that insight. And I really like that point of how it's not just up to that one. When creating healthy lifestyles, everyone plays a role. So not just the person plays the role, but it's also the policymakers that decide if there's going to be healthy parks, healthy and attainable lifestyles, if there's going to be grocery stores within that community. And I want to touch base on a question that I think a member in the audience asked earlier about why do these diseases disproportionately affect certain communities. And I think that's where it takes place because there is a lack of resources for certain communities. And that's why we're trying to achieve that equity standpoint where we're giving every community what they need in order to attain that healthy lifestyle. It's like, for example, if there's two people and they're both on a stool and they're trying to look over this gate. One person is up here, so obviously they can look over the gate, but one person is situated down here. Obviously, we're going to give this person a lot more resources so that they can be on the same level with that person. I believe that's what equity is, and that's what we're trying to achieve in the medical standpoint. So now, venturing off, going to the actual profession that you do, I wanted to ask you a few questions. So I wanted to know, how can young people pursue a career in cardiology?
The first thing that you have to do to become a cardiologist is start as a young person focusing on doing well in school, because this is a competitive field, and I don't have to tell you that getting into medical school is a competitive thing. So again, you want to start early and focus on taking school seriously and doing well in school. And then I think it's useful to interact with people in the field that you're thinking about. So I spend a lot of time with young people at all different stages of their lives, just letting them interact with us, sometimes one-on-one, sometimes in the clinic, sometimes seeing patients. I think that's a very useful activity as well. And putting the time in really to make it happen for you is incredibly important. and making sure that this is something that you want to do. But to anybody who say they want to be a cardiologist, or you or anybody else, I would encourage them to come and spend time with and around people like me who are doing this, and see what we do and be inspired and excited. This is I have a lot of fun with what I do, Savannah.
Thank you so much. I want to touch on what you said on your last point, making sure you reach out to cardiologists like you, because youth don't have to wait until they're a cardiologist to make an impact. They can reach out to their local doctors. They can see how they can help. They can see how they can assist, and they can see what they can learn from these cardiologists. Thank you so much for that. And we have a question from the audience. The question says, what advice would you give to a young person who wants to help and heal, but may be fearful about the difficulty of medical school?
I'm sorry, repeat the last part of that, Savannah. I didn't hear. They're fearful about what?
Okay. What advice would you give to a young person who wants to help and heal, but may be fearful of the difficulty of medical school?
Well, so the first thing I would do is I would begin to investigate what that fear is based on. Because if there is help here, then where is the fear coming from regarding medicine? And I understand that some people are indeed fearful of doctors, of operating rooms, of procedures, and of medicine. But sometimes we need to consider the alternative, which is a fear of the disease itself, or the process that's causing somebody suffering and pain, and how we're going to get them out of that. But so I would flip the question back to them and try to understand where that fear is coming from.
Sounds good. Thank you so much.
We're some questions have come up in our society around the world recently about the ability of science to do some of the things that it purports to be able to do. And we're all struggling to understand where that's coming from. But there's no question that A, we don't have all the answers, but B, we do have some of the answers. And so if we have the answer for you, then I would encourage anybody to seek us out and, avail yourself of the opportunity to be helped or healed, where we do have an answer for whatever the situation is. We have lots of answers.
Yes, and I believe that person in the audience was also referring to how difficult medical school is, because it's so long and it's so extensive. And I do want to touch base on what you said earlier. When you said, while you were answering my question of how to become a cardiologist, you said that make sure it's something that you truly want to do, because it is a time commitment and it will take some time. So that's why shadowing these doctors are so important. So you get a feel of what they do in their everyday professions, and so that you have a better understanding of that career. And then, did you want to add anything?
Well, yes, I think anything that you decide to do, be it go to medical school, be it play professional basketball, be it run for office, right? To be good at it takes a lot of practice and a lot of effort. And anything that's worth doing is worth doing well. Yeah. And if you're going to do it well, you're going to have to put the time in to practice the craft, to get better at it. And then you can provide that service to other people at a very high level. If you're not providing it at a very high level, you may not really be doing them any favor. So yes, it does take time, but it takes that amount of time and effort to be good at anything. And I would encourage people to think about, anything that you pick up and say, this is something I want to do, that you're prepared to put the effort in to become good at it, and then deliver it at that high level.
Thank you so much, Dr. Morgan. Those words just spoke directly to me, especially because I am an aspiring cardiologist, so I will definitely take that to heart. I believe we have one more question from the audience, and it says, Dr. Morgan, can you please give us an overview of what a healthy heart should look like?
An overview of what a healthy heart should look like. It's almost easier if I could show you a picture, but there are two things that make up, the heart function, and that is the heart is a muscle in the body that has to pump. That's its function, to pump blood around the body. And so the ability to pump at an adequate level is part of being a healthy heart. And one of the heart problems that we encounter frequently is hearts that have become too weak to pump efficiently, and they just don't get enough blood around the body. And that creates a situation that we call heart failure. The other thing I would say is that because it's a muscle and it has to work, it requires an oxygen supply, which it gets itself from the blood, the heart does. And that comes through these small arteries called the coronaries. And so you want to have the coronaries be clean to supply enough oxygen to the body. It's when one of those little blood vessels gets blocked off with plaque, atherosclerotic plaque that builds up over years, that somebody can get a heart attack. And there are other parts of the heart that need to function. It's a complicated organ that need to function properly for it to be efficient. And when it's inefficient or when it stops functioning altogether, that's when we have real problems.
Thank you so much for that insight, Dr. Morgan. We've learned so much from our discussion, and I'm so great to have this discussion with you. Now we're going to go back to Mr. Kennedy. He's going to hop on, and we are going to be doing the outro of Healthy Doses with Dr. Kennedy.
Well, that was an amazing segment, Savannah. And like I said, you're a superstar. And I don't think I could have done that better myself.
Thank you. I'm so honored.
Yeah. So, Dr. Morgan, before we close out, before I ask my final question, Savannah, before you leave, you're doing a lot of amazing work. I know you have a book and you're doing some amazing things. Is there any way, if anybody wants to follow up or if anybody wants to purchase the book, do you have any way that they can reach out to you or follow you on any of the social medias or anything like that?
So that's a good question. So I have a website that everyone can go to. I don't know if we could type it in the chat, but that is www.happyheartadvice.com, just as the words say it. So that's my website, and everyone can follow my newsletter. And also, I have a YouTube page where everyone can search Happy Heart Advices. I upload YouTube videos about the heart, about heart health, but also about mental health, because that's a segment that I have been venturing into. As you know, one is not healthy without mental health and physical health both balanced out. So I've been venturing into that segment. And so that's my podcast I have. And I believe that I also, for my book, people can buy it on Amazon. So if they search up my name, Savannah Carmel, as it's seen on the screen, it'll pop up and they can buy it on Amazon.
Savannah, thank you so much, and thank you for joining us. I think this show couldn't have been better without you.
Thank you so much for having me. Have a great day.
All right, bye-bye. Dr. Morgan, I know we're bringing the show to a close, but I did have one more question before we go into our final segment, and where we'll lead the audience with something they can really take away. But my question is kind of, I know as humans, we group up and we're social animals. And one of my favorite things to say, life meanings is iron sharpens iron. And so I know we've been talking about heart health and things that we can do personally, individually, but support is very important, especially in these struggles, to have somebody, an advocate or an accountability partner, or what can people do to help each other? Maybe whether it's your family members or friends, what can somebody do to kind of help encourage, good, healthy habits and good heart health amongst a family to try to break these generational curses, if you will?
I think the first thing we could start with, Ray, is conversations, right? We could talk about it, which is something that we don't do enough, right? So earlier you mentioned your family and all the people in it who have high blood pressure, and I would engage you and I would say, so Ray, what are you doing to make sure that you don't have this problem that seems to be prevalent in your family? I think we could talk about how we're all eating together at meals when we get together, and discuss, look, Ray, remember your family has this risk. And so perhaps, eating that burger and fries from McDonald's is not the sharpest thing for you to be doing. I think in our communities, we could organize events and activities that we do together that provide more physical activity. The neighborhood I live in particular, people like to walk, and people get together and they go out and they go on walks for the sole purpose of taking a walk and getting an exercise. And my wife will say to me sometimes, or I'll say to her, let's go for a walk. We'll walk a couple of miles, we'll chat. I don't know what we chat about, but we get the activity in. And I think we can all encourage each other in this regard with conversations that I think we don't have enough of. People don't like to talk about all these things, but I think it would be healthier for us if we would engage each other in these kinds of conversations.
Yes, sir. That's great. Well, Dr. Morgan, we've had such a great conversation. One of the things I did want to point out is for the audience, having that person that really helps. You asked, what am I doing? My wife actually is one of the people that kind of is my accountability partner. Like, she'll smack food out my hands, or she knows I'm competitive, and so she'll be like, I'm going to work out. I don't know why you're still sitting on the couch. And so that becomes like a draw or motivator. And so really, like I said, my life's philosophy is iron sharpens iron. We can all help each other. And so I think if we start coming together as a community, like Dr. Morgan said, having those conversations and really kind of grouping together and having that strength in numbers, we can really start to kind of tackle and attack this before it becomes a serious problem.
And the work that you're doing, Ray, in STEM City and in the Healthy Doses, getting information out to people, is also another one of these conversations that we could have much more of, because there is an education gap for people with regards to, what are the things that are affecting my health, and what are the things that I could be doing about it to be better.
Well, Dr. Morgan, this has been a great conversation. Is there anything that you want to leave the audience with, anything to kind of wrap up that they could take away from today?
Yes. I want to come back to the issue of hypertension, and I want to just have everybody be reminded that the biggest preventable thing people can do for hypertension is watch their salt intake, and just, pay attention to which foods are high in salt. You can Google it. It's sometimes a surprising list, and try to stay away from that. It's not so much a matter of what we do to ourselves in terms of adding salt to our food, sprinkling it at the table or whatever. It's a food processing issue. It's a food that we're presented to, and we all just need to educate ourselves about that and try to reduce our salt intake so as to avoid getting high blood pressure. You don't want to have a stroke. You don't want to have heart failure. You want to stay away from people like me if you can, other than socially, of course.
I say you're not such a bad guy, but I don't want to see you at work.
That's right. That's right.
Yes, sir.
We can watch a game together, Ray, but stay away from the office.
Yes, sir. So thank you, Dr. Morgan. Great conversation. I really hope we were able to kind of help some people. Thank you to Savannah for coming on and having a great conversation with us. If you want to follow up or join Savannah's newsletter, be sure to go to that address at the bottom, Happy Heart Advice, and join her newsletter. She's doing amazing things. And so we look forward to see what's the years have to come, Savannah. And so we thank you. Dr. Morgan, is there anything, any way if people need to get in contact with you, any information that they will be able to find you?
I didn't sort of come prepared for that, but I'm out there. I'm on Google. You can find me if you want to talk to me. Athol Morgan, Baltimore. I'm happy to engage with anybody. I was excited to meet Savannah here today. Savannah, you want to be a cardiologist? I would encourage you to reach out to me. We spend more time together. There's a lot of information that I could share. And thank you to you, Ray, and to the STEM City crew for this opportunity. It's been an exciting morning.
Yes, sir. It's been my pleasure. And final thank yous to our audience and also to our sponsors and our partners over at Boston Scientific. This is Healthy Doses. We hope you join us next week at the same time, 11 a.m. You guys take care and enjoy your weekend.
For more than 40 years, Boston Scientific has relied on our spirit of relentless innovation to advance science for life. We have the privilege and responsibility to deliver higher quality, less invasive, and more accessible device solutions, and the need has never been greater. Boston Scientific technologies are used to treat roughly 30 million patients around the world each year. Across our business, our products are supported by vast clinical data, including bench testing, randomized controlled trials, and ongoing real-world evidence to ensure the highest quality products make it into the hands of our customers. And we're always looking for ways to provide even more effective therapies and solutions. We invest over $1 billion annually in research and development to sustain a robust pipeline of meaningful innovations. We continuously strengthen our manufacturing and operations capabilities with artificial intelligence and advanced microelectronics to create devices that are smaller and smarter. And we're collaborating with our medical partners and physicians to advance digital capabilities with remote device support and a broad scope of training and education programs. Advancing science for life is also about supporting our employees and the communities in which we operate. Now more than ever, we rely on our values to guide our company as a global business and as a global core citizen. We're working to help confront healthcare inequities and social injustice, not only with financial contributions, but through volunteer service, advocacy, and expanding market accessibility. We're also focused on environmental initiatives that move us towards our goal of becoming carbon neutral by 2030. The unmet needs are great, but the future of healthcare is bright. Our innovation centers provide a place to explore opportunities, examine solutions, and see what lies ahead for medicine. Together, we can continue the relentless pursuit of innovation to help everyone live longer, healthier lives and make a difference all over the world.